Good afternoon and welcome to the daily briefing here at St. Clair County EMA office, where I'm joined with Sam Bierman from the Health Department and, of course, Chairman Mark Kern of the St. Clair County Board. And for those of you who follow our briefings, we posted earlier today that we've got a couple of special guests with us today. We're going to change it up just a little bit today because this is a true miracle that we're going to talk about today. So, Chairman Kern, why don't you introduce our guests?
So we're very fortunate to be joined today by a COVID-19 survivor. Kevin Anderson is here, and he's joined by Jacquees Anderson, his daughter. And Kevin's here to kind of talk to us about this whole process. We've heard so much about COVID-19, but we've never been able to put a face on it. So today you're going to be our face and tell us just how this came about for you. Can you take us back to March 24th? I believe that's when your story with COVID-19 begins, Mr. Anderson?
Yes. I was working at the juvenile facility in St. Louis, and one of the kids tested positive. And, basically we didn't know how to attack it when he first got it. And then we did, but it was too late. I was already exposed to him. So then I started feeling kind of woozy. Then the next day, I started running a bad fever, and whatnot and everything. And I left work and then went to the extended care service in Collinsville, and they tested me there. And they told me, well, you better go to the hospital immediately. I said, well, I'm going to drive myself. I'm not that sick. Lord, I started sweating and, getting real chills and whatnot. So I made it to the hospital, to emergency. And then they got me in there and they said, well, we need to test you. They started working on me and found out that, I had the virus and everything, the COVID-19. But the biggest problem was that everybody, didn't know how to attack the problem right out the bat. But Memorial did an excellent job in working with me to put me back in shape. But in the process of me having it, I had to go through ventilators. I had to go through being sedated, blood clots in my leg. A lot of people don't know this is serious business when you start getting ailments like this. And it attacks, your blood pressure, your diabetes, cancer, sickle cell, bronchitis, asthma. These are some of the main components that it attaches to and start bringing you down. Obesity, that's one of the two. Overweight. People just think that, well, if I don't, and if you're a smoker and they put you on a ventilator, it's going to be tough times for you. Thank God, I don't smoke right now. I did long years ago, but my lungs are strong enough and whatnot. And then too, I weighed 270 when I went in, and I came out weighing 198. That's 70 pounds right there and whatnot and everything. But I had to wait to lose to fight that battle off, me and God. You got to pray a lot. Your family can't come see you. You can't talk on the phone a lot because you're going through a battery of things that for us trying to get you well. It's hard to stay in there 35 days. Don't talk to your grandson, your wife, your daughters, your kids. But I was blessed to have my kids in there. My daughter, Jacquees, handles the medical. She made a report to her every 8 hours. She was driving them crazy. My other daughter, April, was handling the Facebook account, keeping everybody abreast of what's going on. And people don't know, I had a lot of calls and thought I had passed. And that's hard on your family when you somebody telling you had passed and they don't know and whatnot and everything. But these are some of the things that you go through with this COVID. It's serious. It's real serious. It's serious to the point. Look at the numbers of, 1,500 have it, 500 deaths. Look at the ratio, and it's climbing. It's not going down. With these businesses open up and whatnot and everything, but we got to work. We just got to find a way to be safer. We can't go to the gas pumps, and every time you put your hand on a gas pump, somebody is positive on there, and it stays on surfaces anywhere from, I'm not sure, but anywhere from 15 to 20 hours. You know what I'm saying? So, and whatnot. When you give them your credit card, when you get through using your credit card, wipe it off. Wipe the credit card off, because you just don't know who has it and whatnot and everything. Water fountains, stay away from water fountains right now because, it sticks onto that steel. It's so many things that you got to do to combat this right now. and it's serious. See, some people get it and they just get quarantined for like 4 or 5 days. But I have seen people pass in 5 days. Loved ones, friends, family members, kids, babies. They call me all the way from Chicago asking me what they should and should not do and everything. But the biggest thing right now is playing it safe. Stay at home. If you don't have to go out and rip around the streets and everything, stay at home with your loved ones. This is the time to have good family dinners like we're going to have today.
So how do you, when you're in the hospital and you mentioned that you hear whispering and that people are dying maybe in the next room, how do you keep your emotions in check? Your family can't be there. What did you do? What did you think about? I assume prayer was a big part of it.
Prayer, and then those angels, those angels up there. But I latched on to my grandson. I got an 8-year-old grandson that I'm helped raising, and I said, I'm gonna do this for him. I'm gonna make sure. I'm gonna make sure that I come back home to him, because at 8 years old, you need that role model. And so many young kids, they fall prey to not having that father image around. So I latched on to that. And that what kept me going. When they was putting tubes up my nose and IVs in my arm and sedating me, and
terrible. You're strong. Jaquise, you stepped in and have been a real support for your dad. What did you learn from this, and what would your recommendations be?
I basically learned that it can attack, anyone, right? It's not just older people, it's young people too. I also learned the importance, like my dad said, of healthcare, right? Of having access to healthcare and being able to have resources. And then lastly, just having a support system, because you hear about us, but there's also my dad's wife, I have siblings, and it was kind of like a full court assault of all of us aunts, uncles coming together to make sure he was okay. And it was a scary situation, but you have a lot of people who don't have anyone, right? They can get sick and they live alone, they don't have any family. And I can imagine being in that position. My dad used his grandson, my nephew, as an anchor to help him feel better and stay strong and fight. But what about people who don't have anyone in their corner, right? It just makes you much more grateful for the things you have and the family you have during these times.
So, Mr. Anderson, when you were in the hospital and you were on a ventilator, how many days?
15.
So, and you can't communicate with anyone, the doctors or the nurses, I wouldn't think, very effectively, and so your family then has to make some decisions for you, I would assume.
Well, my wife and daughter, they was, both my daughters were making, some power decisions for me that helped me get through. I've been married 41 years. I don't look it though, but hey, don't look. I still look young now. But
yes, you do.
Hey, but the main thing, I had a good wife, good kids, backing me and whatnot and everything. But I just, when I was sedated, you go through dreaming. I had some bad dreams in there, some bad dreams, because your mind is wandering while you're sedated, and everything. But I came through, you know what I'm saying? But when I came home, people don't know this. When I came home, I didn't sleep for 3 days. Wow. 3 days straight. Because, when you're on that ventilator, you come off, a lot of people die at nighttime. So I was trying to stay woke. I stayed woke for 3 days almost.
And so blood clots still are an issue, and you have to take blood thinners?
Yes, sir. That was one of the main things right now with me, right now and everything, taking those blood thinners, and they're expensive. There's no generic game with those blood thinners, because that's saving your life. That's the only bill out of pocket that I'm fighting, right now, is that the money I need to buy the blood thinners. That's like $250 a month.
Wow, and they're essential. And is that something that you'll be able to wean yourself off of, I would assume, sometime hopefully soon?
Oh, yeah.
Are you're getting out now and be able to walk around the neighborhood a little bit?
Oh, yes, sir. I'm doing my little tiptoeing. I'm walking down the street. My daughter told me don't go too far, But I'm doing around about a mile and I'm like a mile, under a mile, in the neighborhood and whatnot.
Do you look at life a little differently now?
Oh, most definitely, most definitely. I'm looking at putting some things together for my grandson and kids and everybody. Now, see, when this hits, you want to make sure they're secure. After, if I was to pass, I got insurance, but at the same time, I want to make sure they're comfortable. I want them to have to be destitute because I passed. So I'm putting some things together in force right now that make sure that if anything happens to me, that they won't feel the financial burden of me gone.
And there's a lot of people when we go out that I see that just refuse to wear a mask, and they say that it's just not necessary, and that this is something that's just kind of made up by government or by somebody. How do you respond to that?
Come on. My biggest thing is this right here. The numbers that they're giving you on the TV every day, they're actual numbers and everything. They're actual numbers, and you can't play with this. Only thing you got to do is look at overseas in Brazil. They won't let you come home from Brazil right now, even if you're a U.S. citizen, because it's so rampant over there. The only thing they have to do is go to the internet. The internet, one of the biggest things. But you can't believe the internet. Believe in what you see, and when you go to these funeral homes, you go to a funeral right now, you only can let 10 to 20 people come. When you go to the burial, they won't even let you get out your car now.
And they told us when this started that if you went on a ventilator, that your chances of getting off were very slim. So you fought through.
75%. Don't you know that it's 70% or a little bit lower and everything? If you come out that ventilator, you're not going to make it because, the things about it, your lungs, and it's keeping you abreast. But everybody doesn't have that weight. See, I had some weight to get. Them 70 pounds, it helped me a lot because I gave me the strength. If you weigh 200 pounds and you lose 70, how much do you weigh? You weigh 130. How can you fight off a ventilator? You know what I'm saying? Weighing 130 pounds. It's hard because your body has to be tough.
Did you know that when you were on a ventilator? Did you know that the risks were that high?
Yeah. They told me prior, or I was reading up on it and everything. The risk is scary, but the blood clots were more scary because when you sleep at night, they can run up your leg and go to your chest. When you're on a ventilator, at least they can monitor you. But that ventilator is scary. That was I took the coma, but the ventilator and the blood clots, that's why people got to take this serious because when you get those issues, it's just so much they can do to help you when you're up in there. I'm fighting off battle after battle after battle, from blood clots to comas to feed me in the stomach. They feed me through my stomach and nose. Pipes, hoses going through your nose and you woke. So they put a thing up your nose so it can go down your throat.
Wow.
While you woke. See, that's why these masks are serious. These masks are more serious than what people think. It's not going to stop everything. Don't get me wrong. But it's a deterrent. If you're breathing on somebody, don't you know that vapor stays in a mist or like around about anywhere from 15 to 20 seconds? You can get it. You can get it by touching surfaces. You can get it by people breathing on you. But at least if you got a mask, you can fight some of it off.
And you got it pretty quickly, it seems, that those symptoms hit you and you were in the ER before you knew it.
Yeah, it hit me because one thing about it, like I tell you, the ailments, the high blood pressure. I got high blood pressure. I got diabetes.
Over 60.
And over 60. She's telling everybody my age.
That's what daughters are good for.
Yeah, you better know it. And people got to realize that, it's just so much that you all can keep preaching. But when they get it, sometimes it takes a tragedy to make us wake up. That's what I wanted to say. It makes a tragedy. I'm for real about it because one thing about it, I pray it every night. I can come home. Some people up in Chicago with the numbers running rampant up there, they don't come home. And especially when you're in the nursing homes and you're taking it to your grandparents and you're going to a nursing home without no mask on.
Right.
And you're going to visit your loved one and you're killing them and don't even know it.
So Herb Simmons is here and has a couple questions. I can see it in his face.
Of course, Mr. Anderson, I really appreciate you taking the time today, you and your daughter, and it was really a blessing to get you to come on here today. As I sit here and listen to you talk to the chairman, and I can still hear your voice when you were in the hospital for those 35 days or whatever it was there the time when you just was giving up? Did you ever reach that point where you thought,
Mm.
or did you just keep fighting?
I kept fighting. I kept fighting. I'm talking about every day I kept fighting because once you give up, once you throw in the towel, then it's hard to come back. And then too, these people, these healthcare workers, they're putting their life on the line.
Exactly.
These CNAs, LPNs, RNs, doctors, you got to help fight with them. They're trying to save you. So you got to really, really fight. But there's a lot of, I couldn't give up. I got too much to live for.
That's great. A question for your daughter. Can you explain to our followers the family? How did the family unite together, and what kind of feelings did it cause you to know that here's Dad in the hospital, you can't go see him? That had to be real rough on everybody.
Yeah, I think it was rough on everyone because, I think the hospitals, you still can't have visitors for any reason, especially with COVID. So I think everybody was just trying to maintain as best as they could, right? And I think the feeling that everybody had was hope because, all of us know that he's a fighter. So I think that that's what we tried to rally around. And, we had a family chat that had, all of us in it, aunts, uncles, so that everyone could just stay updated and just stay, prayed up and get updates on his progress. But I think we all knew his personality and knew that he would try to fight to come back home.
Well, it sounds like the fire prayer really helped out in this case again. And, Mr. Anderson, we talked earlier this morning. I told you that we have followers on there, and we have a lot of great members of what we call Team St. Clair. And then we have some of the naysayers. And some of the naysayers continually say, don't worry about the COVID, it's only the flu. What do you say when you hear those type of comments? Is this just a standard flu, would you think?
No. It's, it has some symptoms of the flu, but this right here, it goes a notch above that because with the flu, you have colds and you have symptoms. This right here attaches on to your weaknesses. The flu, if you have a cold, what you do? You go take Theraflu, this and that. This right here, your immune system has to be in place to fight this off. Some people, why do you think the numbers are so high? Because their immune system can't fight it off. You got old, elderly people. Like you said, it's a kid died today, 20 years old?
Yeah, the other day we had a 20-year-old pass away.
Yeah. So what is that telling you? That and he's strong. At 20 years old, that tells you right there and there at 20. So it doesn't discriminate. It crosses over all boundaries of life and health. That flu, it had flu-like symptoms, but in retrospect to the medicine you get and the time, you got to have a lot of time to invest in getting well in this. See, colds come and go. This don't come and go as fast. You know what I'm saying?
Well,
Especially when we had one of the coaches die, and everything, and it's just on and on and on. It's ailments, and people got to. Well, you know what? Only thing they got to do is keep reading and keep praying, because one thing about it, this is not going away anytime soon. You might get ready for the second wave.
Well, and that's what I think we're trying to do. And you coming on here today telling your story, and that's the other thing I wanted to point out, that there was a comment, one person that wrote that we were doing nothing but exploiting you, and I wanted to make sure that our followers understand that you came on here of your free will and trying to spread that message. You already said you've been in touch with the Lieutenant Governor and the Governor's office, and I think I applaud you for that, to spread your word, because you may be able to save somebody else from going through that terrible situation.
Right. And like I said, me and my wife, we sit back constantly and just thank God. But see, people exploit me. When your life is on the line and you're sitting up there in the hospital bed and there's nobody to talk to, and and nobody to come see you, you look at life a little different. It's not a game. People, you know what? It hurts me to say this though. Some will, some won't, so what? Some will, some will, so what? You got to have that mentality that, hey, you got to be a fighter, but you got to be a listener too, because they're telling you that, after the protest, over with around about another week or so, watch the numbers climb. Watch the number climb.
Yeah, that's what we're worried about.
Oh yeah,
Yes.
they're gonna climb because all those massive people protesting, and we need protesters and that. But when that's over with, the spread of it gonna kill a lot of people. You watch.
Well, we hope not, but that's what we're watching for. And I want to tell you, I know I'm speaking on behalf of Chairman Kern and Sam. Our team St. Clair, I think we would like to add the Anderson family as a member of our team St. Clair because you have been through a battle of this invisible enemy. And I can't think of anybody else better to be a leader for our team St. Clair. And we really appreciate you coming on here today, spreading your story. Don't you agree, Chairman?
I do. And Mr. Anderson, I mean, we didn't have a chance to talk about all that you do and have done all your life to help out the community, and you work with youth, and you have so much that you've accomplished in your life, and for you then to come out and have one more thing to do, which is right now to talk about warning people about the dangers of COVID. We appreciate that very much. That's just one more step in a long list of things that you've done for the community, and we got a long way to go.
Thank you now.
Thank you very much.
Thank you very much. Thank
If
you,
anything I can
Jaquez.
do, speaking at any engagements or people, they can call me, they can call me or they can go to my email, ultfinancial@yahoo.com. Leave me a message and I promise I'll call you back. That's ultfinancial@yahoo.com. And I'm there for anybody want to, call me.
Thank you again. We really, this has really been really great, and I can't say enough to thank you both for being here today. Thank you.
Thank both of you. Thank you. Uh-huh. Wow. What a touching story. So, Sam.
Wow. Well, that puts me in
How do you follow that other than numbers?
I don't know that I can. I mean, Mr. Anderson, clearly an inspiration, not only showing us, the real effects of what COVID-19 can do, but showing you how his fighting spirit and his faith got him through. So, I will attempt to follow him. I know I will pale in comparison. So as of today, 9,202 have been tested in St. Clair County with 1,440 positive test results, which is an increase of 36 from yesterday. And that does include both males and females from under the age of 10 up to their 90s. We are at 7,741 negative test results, with 21 results that are still pending. And we do have one additional death to report today, which brings our St. Clair County total to 105. And that was a female in her 90s who had unknown health conditions. And as always, our condolences go out to her family. For those that have completed the IDPH 14-day required quarantine, we are at 912. For state totals, we are at 1,022,074 that have been tested, with 126,890 positive test results, which is an increase of 975 from yesterday. For deaths for the state, we are at 5,864, which is an increase of 72 from yesterday. For our hospitalization numbers, and those are for hospitals that are in St. Clair County, currently, 56 patients are hospitalized due to COVID-related reasons, and 4 of those patients are on ventilators. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 42 cases and 4 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 12 cases and no deaths. Caseyville Nursing and Rehab has 3 cases and no deaths. Cedarhurst of Shiloh has 12 cases and no deaths. Cedar Ridge of Lebanon has 16 cases and 1 death. Colonnade Senior Living in O'Fallon has 4 cases and no deaths. Four Fountains in Belleville has 104 cases and 25 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center in Lebanon has 54 cases and 10 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. New Athens Home for the Aged has 52 cases and 3 deaths. St. Paul's Home in Belleville has 42 cases and 12 deaths. Swansea Rehab and Care Center has 24 cases and 2 deaths. And TDL Incorporated in Belleville has 4 cases and no deaths. And now I will turn it over to Chairman Kern for his update.
Thanks, Sam. Today we'll go into the zip code reports. Remember, if you don't hear your zip code, it doesn't mean that there is not a COVID positive person in your zip code. It just means that you haven't risen to the level above 5 people yet. So in 62059, we remain at 7. 62201 goes up by 3 today to 25. 62203 remains the same at 47. 62204 remains the same at 50. In 62205, we go up by 2 to 58. And in 62206, we now go up 4 to 122. In 62207, we go up by 3 to 81. In 62208, we go up by 1 today to 84. In 62220, we remain the same at 147. In 62221, we go up by 5 to 121. In 62223, we go up by 2 to 57. In 62226, we go up by 6 today to 160. 62232, we go up by 1 to 28. 62239 remains the same at 15. 62243 remains the same at 8. In 62254, we actually go down by 2 today to 52. That number goes down because people move or shift or a wrong zip code was given, so we always amend those reports to let you know the exact number the day we know it. 62254 has 52, and that's a decrease of 2. In 62257, today we remain the same at 12. In 62258, we remain the same at 15. In 62260, we go up by 4 today to 15. In 62264, we remain the same at 47. 62269 goes up by 1 to 80. And 62285 remains the same at 15. Herb?
Wow. I'm just taken back by Mr. Anderson. And, we heard the numbers that Sam gave today, 36 more new positives in the county, which we say all along, more testing. We expect that to happen. What we don't like to see happen is one extra death, but I'm sure glad Mr. Anderson did make that category, and I'm sure him and his whole family are too. And as I said, they're a part of the Team St. Clair now, and that's a voice that I think for those of you who are following us today, looking at some of the comments, I think it touched home to a lot of us, and that's a success story that we can hopefully make other people understand that this thing's not over with. You heard Mr. Anderson say, possibly a round 2, which we've been telling you. He definitely wants to get that message out there. All the way to the lieutenant governor has reached out to him because there's a lot of those that aren't with us to tell those stories. So we appreciate everybody following us today. Tomorrow will be our question and answer session, Sunday. So if you've got any, that portal will be opened up later on, and you submit your questions through that. And Sunday we'll answer those questions, or at least try to get you an answer. We'll be back with Cindy and Daisy to translate this into the Spanish communities. And please be a part of Team St. Clair. You see what it can do when we all work together. Practice social distancing. Wear the face covering when you're out, and we'll get through this. We'll see you tomorrow afternoon at 3:30.